To understand the prescribing in liver disease, let's have a quick look at the functions of the liver. One function is metabolism, and the liver metabolizes carbohydrates, hormones, drugs, and toxins. Another function is making of clotting factors, cholesterol, protein, and bile. The liver is also important for clearing bilirubin, cholesterol, and waste products. It's also responsible to store fat-soluble vitamins, filter antigens, and detoxifies and clears drugs. One of the complications of liver disease is hepatic encephalopathy. This is a neuropsychiatric syndrome where the brain function declines. This happens because there's an increased buildup of gut-derived toxins such as ammonia. This then causes an increased buildup of toxins in the blood which circulate and cause brain damage. Normally, the liver would remove this ammonia as one of the functions of the liver is to clear waste products. But in liver disease, it is unable to do so, which causes symptoms such as reduced concentration, confusion, drowsiness, changes in personality and sleeping, and in severe cases coma. Hepatic encephalopathy can be triggered and worsened if the patient has an infection or is taking sedating medication. Sedating medication will slow down brain activity and so worsen the neuropsychiatric symptoms. Changes in electrolyte, gut microorganisms, and low muscle mass also play a role. Treatment involves limiting protein in the diet. This is because nitrogen is a component of amino acid and urea, and proteins are made up of amino acids. So by limiting protein in the diet, it limits nitrogenous products that are produced. There is 2 drug treatments that can be prescribed. First one involves the laxative lactulose, commonly at a dose of 20 ml 3 times a day, to allow 2 to 3 bowel movements a day. Lactulose works by affecting the handling of nitrogen in the intestine. It works in 2 ways. One way it works is by increasing the nitrogen output in the feces, meaning less is available in the circulation. The second way it works is that the lactulose is converted by the gut bacteria to lactic acid. This makes the gut acidic, which decreases the amount of protein that is converted to ammonia, as ammonia is basic. This then reduces the formation of ammonia. If the patient is on lactulose and is still experiencing neuropsychiatric symptoms, an antimicrobial agent called rifaximin can be added. This kills gut bacteria, leading to a reduction in ammonia production. Rifaximin is normally given at a dose of 550 mg twice a day. Another complication of liver disease is ascites. This is when there is a buildup of too much fluid in a region called the peritoneal cavity. This is the region between the abdomen and abdominal organs, as shown in grey in the diagram. The aim is to get rid of this excess fluid, and this can be achieved in 3 different ways. Either non-drug treatments, drug treatments, or procedural treatments. Non-drug treatment involves bed rest, because an upright posture has shown to get rid of sodium, which prevents buildup of fluid. Also, restricting the patient's fluid intake to a maximum of 1.5 litres per day, and their sodium intake to a maximum of 5.2 grams per day. It can also be beneficial to stop drugs that either retain fluid, such as corticosteroids and non-steroidal anti-inflammatory drugs, or drugs that increase sodium, such as effervescent tablets. If non-drug treatment is not enough to reduce the ascitic fluid, drug treatment may be required. This involves using agents called diuretics, which cause the body to remove excess sodium and fluid into the urine. First-line drug is an aldosterone antagonist called spironolactone. This should be started at a dose of 100 mg once a day, but can be increased to 400 mg once a day if a greater response is needed. If this drug alone is still not enough to reduce the ascitic fluid, a loop diuretic such as furosemide can also be added, at a dose of 40 mg once a day and increased every 2 to 3 days to a maximum of 160 mg once a day if needed. The aim with diuretic therapy is that the patient loses approximately 0.5 to 1 kg of water weight per day. If the ascitic fluid is still present, a procedure called paracentesis can be done. This is where a large needle is directly inserted into the peritoneal cavity, causing drainage of the fluid. This procedure should be done over 1 to 4 hours. When the ascitic fluid becomes infected, it can cause spontaneous bacterial peritonitis. Patients may be symptomless and have normal white blood cell count and C-reactive protein. The diagnosis of spontaneous bacterial peritonitis is confirmed when the neutrophil count in the ascitic fluid is greater than 250 cells per millimeter cubed. Treatment involves antibiotics to clear this infection, and the duration of the antibiotics depends on the severity of the disease. In severe disease, antibiotic therapy will last 5 to 7 days. First line commonly is intravenous piperacillin or tazobactam at a dose of 4.5 gram 3 times a day. However, if the patient has a mild penicillin allergy, intravenous cefuroxime at a dose of 1.5 gram 3 times a day and metronidazole 500 mg 3 times a day can also be added if needed. If the patient has a severe penicillin allergy, intravenous levofloxacin at a dose of 500 mg twice a day is commonly used, and intravenous metronidazole can also be added if needed. If the severity of the disease is mild, treatment is commonly for 5 days. First line is oral cotrimoxazole at a dose of 960 mg twice a day or ciprofloxacin at 500 mg twice a day. Another complication of liver disease is pruritis. This is itching, which is thought to be due to buildup of bile salts. Normally, one of the functions of the liver is to remove bile salts, but in liver disease, the bile salts build up. The aim of the treatment is to remove this buildup of bile salt and so relieve the itching. This can be done with agents called ion exchange resin, such as cholestyramine. It comes in sachets and is given at a dose of 4 to 8 grams per day. Cholestyramine works by binding to bile acids in the gastrointestinal tract and prevent its reabsorption, and so the bile salt is excreted in the feces. Additional medication that can be used are menthol cream, which has a cooling effect on the skin. Antihistamines are not very effective, but the sedating ones, such as chloramphenemine, can be used to help patients sleep if itching is causing sleep disturbances. More serious complication of liver disease is hepatorenal syndrome. This is when the liver disease is so extensive, it causes impairment of the kidneys. There's 2 types of hepatorenal syndromes. Type 1, which is when the kidney function worsens very quickly. Treatment involves 3 steps. Firstly, stopping any diuretic therapy, which worsens kidney function. Secondly, stopping any intravenous fluids that are given to the patient. And thirdly, using a vasoconstricting agent called terlipressin, alongside albumin. This helps to increase blood flow to the kidney. Type 2 is when the kidney function worsens gradually, and treatment commonly involves terlipressin and albumin. If the damage is too extensive, a liver transplant may be required. Portal hypertension is when the pressure in the portal vein becomes too high. Normal pressure lies between 5 to 10 mm of mercury. This happens because of increased resistance to the flow of blood through the liver due to cirrhosis, fibrosis, and scarring. This prevents normal blood flow through the liver and causes portal hypertension. It can lead to ascites and varices. Treatment of portal hypertension involves giving a non-selective beta blocker such as propranolol, starting at a dose of 40 mg twice a day, increasing to 80 mg and 160 mg twice a day if needed. This then lowers the portal blood pressure back to normal. Varices occur when the blood flow through the liver has been slowed down because of scarring in extensive liver disease. This causes the pressure in the portal vein to go up. This can then push the blood into the surrounding blood vessels, including those at the bottom of the esophagus. These vessels in the esophagus have very thin walls, and this extra blood causes them to swell up and burst, which can cause variceal bleeding. This can be life-threatening. Primary prevention should be given in patients who have cirrhosis and fibrosis to prevent variceal bleeding from occurring. Variceal banding can be used, where the vein is banded in a way to cut off the blood flow through the vein. Non-selective beta blockers, such as propranolol, are also commonly prescribed. If there is active bleeding, there may be a need to perform resuscitation. A vasoconstrictor, terlipressin, is also commonly prescribed. Antibiotics, such as cefuroxime, can also be given. Variceal banding or balloon tamponade may be required. Balloon tamponade is a procedure in which a balloon is inflated within the esophagus. This then applies pressure to the blood vessels that are bleeding in order to compress the vessels and stop the bleeding. Following an episode of bleeding, a secondary prevention with a non-selective beta blocker, such as propranolol or nadolol, should be given.